Okay, we're recording again now after a short break. Let's see. So you were talking about how discovering anatomy textbooks that your father brought home. He was a janitor and he would bring home these anatomy textbooks from, where did he work again? Can you remind me?
HHMI, it was Howard Hughes Medical Institute.
And so that sparked your interest in like how the human body works. And your mom also bought you books that sparked your interest in medicine and in science. Could you talk a little bit about how you were drawn in particular to community health? What sort of challenges related to health do you see in low income and immigrant communities in particular?
Well, growing up, I would hear about people in our network who didn't have doctors, who couldn't afford to go to the doctor, or who were terrified to go to the doctor because they felt like, oh my God, I'm going to end up being broken in the streets. And so they didn't always get the healthcare that they needed. When my parents got divorced, my mom was one of those individuals. So she has high blood pressure. And so she was always terrified about her blood pressure wasn't managed the best. So she would go to the doctor and enough to get her prescription medication. And so my pediatrician, when we would go, he would check her blood pressure because he knew she couldn't go once every 3 months, like you're supposed to go. And then a lot of family members would go to the home country, those that had papers, to get dental procedures, surgeries, and just go see a doctor. It was cheaper to fly home, buy a plane ticket, fly home, than see a doctor. And so the things like that, I was like, oh, wow, this is not okay. And then in medical school, just experiencing translating and listening to both sides of the conversation, I saw how much was missed.
That's very interesting.
The words are there, but the message and a lot of I can tell you, translating that you have diabetes is one thing, but like what that means wasn't always translated. And I don't know, I just felt like I saw that not speaking in the language, I see how much is missed. And now as a provider, I see how much is missed when I am speaking with somebody who doesn't speak English or Spanish. I see how hard it is for me to communicate with them and how hard it is for them to communicate with me. And a lot of the times I feel like they don't fully understand what's going on, which is very frustrating. And so I see that with immigrants from other cultures, how much of the message is missed. When I'm translating for other people, I see how much of the message is missed. And so I don't know, those are some of the things that are like, oh, okay, this is why I would like to work with immigrant communities.
Those are some great examples about how language and knowledge of culture can really help get an insight into helping your patients. Tell me a little bit about the patients that you treat in Los Angeles. Are they mostly from Central America originally or from all over Latin America? Where are they from originally?
Well, I work for county, so everyone is, it's county. So everybody comes from lower income areas. I work with people from everywhere, Americans, white, African-American, and then I do also have a lot of Latinos. In my panel, I tend to have a lot of Spanish speaking. Personally, I see a lot of Guatemalans. I don't know if it's because I'm Guatemalan, so they tend to flock to me. I have a couple of Nicaraguan patients, a couple of other Central American, definitely a lot of Mexican, but I mean, I'm also in LA, and a lot of Peruvian. So it's a little bit of all different countries, at least my Latino panels, a little bit of everywhere. I tend to, if I see a Guatemalan, they tend to stay in my panel. Actually, I usually like to keep all my patients just because I like to get to know the people better. But in my Latino population, it's a little bit of everything. Yeah, but I have everything. I also have a lot of Pashto speaking refugees from Afghanistan.
Interesting.
And those are very hard. And I've had to look into really read about the culture, ask some of my Afghani friends a little bit about the culture, why they're coming here, what things are facing, and how I talk to them. With time, I'm learning how to word and phrase and certain questions to be a little bit different. So I have that.
That's interesting because I've interviewed a few Afghan students for this project, and some of them mentioned that many Afghans are settling in California. So maybe I can get the MC students to talk with you. You could talk with them, and there could be more communication between you. I think that's interesting.
And then different Asian
sorry,
countries.
go ahead. I didn't mean to interrupt you. Go ahead.
Oh, and I also have patients from different Asian countries. A lot of Filipinos and other Asian countries.
Interesting. What were the circumstances in Guatemala that led your mother to make a new life in the United States? What was happening in Guatemala at the time she decided to immigrate?
Well, with my mom is a little bit different. My mom comes from upper middle class family in Guatemala. And so her dad died from complications of diabetes when my mom was like 16. So it's right before starting college. And so prior to that, she would have had her dad still been alive, she would have had the opportunity to go to college. She would have been able to study medicine. It would have been no problem. She would have been fully funded. But after her dad died, my mom came from the second wife of her dad. And so it was the kids from the third wife that had everything, kept all his money, kept all the properties and everything. So my mom and her sister ended up with nothing. And so for her going to college, she did start college there, but she wasn't able to finish because she couldn't afford it. So for her, she wanted to make sure her sister had the opportunity to finish. And she wanted to have better job opportunities. So she came here. So she was able to get a visa and come on a plane. So her story is a little bit different. My dad story is more the traditional story. So my understanding is my dad was born in the slums of Ecuador, or Quito, capital city. My understanding, I don't know much about my dad's family. This is from what I remember of the stories he used to tell me when we were growing up. Is his father was a unemployed musician. And so he was the second youngest of 6 kids. And his mom would be the one who supported all 6 of the kids and her husband. And so my dad would wake up at 3 o'clock in the morning to buy everything and make sweets to sell at his school. And that's how his mom provided for everybody. And so my dad went to Mexico at the age of 18 and was able to, he sweet talked some American ladies to sneak him in across the border. So here in California, he did his life, he got papers, he then went to the East Coast, joined the Air Force. And so he was responsible for giving the opportunity to all his siblings and his parents to come here and make a life in the United States. Some of them chose to stay in Ecuador, but even though he was one of the youngest, he still paid for the college of one of his older siblings and basically gave them the opportunity. So for them, it was poverty and no opportunities. My dad didn't finish. I think he went up to 6th grade at the most in education.
Did you say that your mom was interested in having a medical career at one point?
Yeah, it was her dream. And so her dream was lived on through me.
She must be very proud of you.
Yeah, she's very happy that at least one of us was able to do it.
Are you the oldest of the three in your family?
Yeah, I'm the eldest of the same kids with my mom and dad.
And if I remember correctly, did your sister become a nurse? Is that right?
Mm-hmm. She's my little sister is a nurse.
And is your brother also interested in medicine?
No, he was a lot smarter than us. And he's in cybersecurity.
Interesting. I think the story that you tell is very interesting about people who didn't have opportunities, but you were able to have an educational opportunity and make a better life. Do you ever feel like you are stereotyped as a Latino? Do people make assumptions or generalizations about you?
At this point in time, Yes, throughout my journey, yes. The way I express myself, the way I dress wasn't always appropriate in or like during medical school. I think right now it's a little bit different because in my program director is a Latina woman, and a lot of my attendings are Latino, so I haven't had that much of it now in residency, because cultural understanding, how we express myself, how we dress, we can at least relate to each other. But in the past, it was something that did cause a lot of conflict and a lot of stress. A lot of the times I was misunderstood. I got in trouble for jewelry I would like wanted to wear and wasn't always deemed professional. Now, as a doctor, a lot of the times people see me walking into the room and they just assume I'm a nurse. But a lot of women, regardless of color, do get that. I feel that because I'm brown, I tend to might get that a little bit more. So for that, I politely just correct people. And I'm like, no, I'm the doctor, or I'm Dr. Baker. And I just introduce myself politely. So I haven't had to deal with that as much.
Can you give some more examples about, I think it was really interesting when you mentioned jewelry or clothing. Can you give specific examples of how sometimes you were not able to express yourself naturally, or maybe you were told to change your appearance in some way to fit in with what was expected of you?
Well, a lot of it is, for example, so I always been interested in primary care. There was a time period where I was between family medicine or OB-GYN. And with OB-GYN, the first time I did it, I did really well. I had really good reviews. And then I did an elective. And then towards the end of the elective, I was told that I needed it. Basically, my course director told me that I needed to take. So one of the things that they didn't like is I wasn't very assertive. And I would always ask permission, and instead of doing things. And then for them was as a sign as I don't know what I'm supposed to be doing, but for me, it was more of a sign of respect. They were my elders, they were my superiors. And so I'm not going to touch a patient unless you give me the permission to, because it's your patient. And so culturally that wasn't appropriate. And so I explained that to my course director, and she was like, well, if you're going to pursue OB-GYN, you're going to have to change some things about your culture. And this is one of them. And so for me, I was like, well, I've already given up a lot of my culture. Sometimes the way I wasn't willing to change that, change more. And so some of the ways, sometimes how I express myself, in medical school, I got in trouble because I went to class. I had just come from an argument with my siblings because we lost our house when I was in medical school, and they didn't understand that I couldn't just fly out and go help them pack, that I had to finish the year first, and then I could go help them and figure that out. And so when I went to class, I was upset, and the teacher interpreted it as me being hostile and aggressive towards her. When I asked all my classmates about it, who were in the room, they were like, what are you talking about? You were upset. But you weren't upset towards us or her or anything associated. You just looked upset, and that was it. And so in medical school, I had to go apologize to her. She went to the dean's office. I had to go apologize. And it was just one of those things where I didn't do anything inappropriate. I was just upset, and my facial expressions and my body language for her was deemed as threatening. And stuff like that.
I think that's a really great concrete example of how people can make assumptions and draw incorrect conclusions. Thanks for sharing that story. That sounds like a very challenging time in your life, for sure. If you could give advice to a Montgomery College student, a new Montgomery College student, just starting, who comes from a Latino background or an immigrant family background, what advice would you give him or her?
So basically, definitely don't give up. Dream big, and dreams only fail when you give up. Now, or giving up is 100% failing. It doesn't necessarily, so when you want something, definitely make a plan. Have a plan with baby steps. I'm like, okay, so for me, it was, I want to be a doctor. So in order to become a doctor, I was like, I have to do undergrad. I have to do certain classes in undergrad and I have to get certain grades. Oh, right. I have to do this test called the MCAT. And I think I'm supposed to get a certain score. So those were my steps. I'm like, okay, so once I have that, I have to fill the application. And then it's like baby steps. So I was like, okay, so first step is get a 4-year degree, work on my grades, and so basically make a timeline with baby steps of all the steps that you have to do to get there. Plan ahead. So in order, when you're making baby steps, you're also planning. So for me, by the time first semester of Montgomery College, I had already outlined every single class I wanted to take throughout each semester during my time there. And so that when we were looking for classes, I knew what classes I would pick, and I also had my backups because sometimes they weren't available. So what is my backup going to be if I can't get this class on this semester? So I always had a plan. I did the same thing with undergrad. Plan ahead, and then ask for a lot of help. If you don't know the process of something, ask for help. Granted, there will be somebody who's gone ahead of you and knows the process and will sit down and teach you how to fill FAFSA, how to apply to medical school, is just, in my situation, that's what it is.
But you have a really ambitious goal to break it into more manageable pieces, step by step.
Yeah. And then any goal is, it's all ambitious, going through college and getting a 4 degree, that's hard, regardless of the degree it is. Be proactive. So foresee any difficulties and obstacles you may have, plan around them. Be very self-aware, know your strengths, know your weaknesses, and know how to sell yourself. And regardless of what field you do, you have to be able to sell yourself. You always have to interview for a job. Know how to present yourself, know how to highlight your weaknesses, and how to make your strengths. Know how to highlight your strengths and how to make your weaknesses look like strengths.
I like that idea, how to make your weaknesses look like strengths, because I think sometimes people perceive speaking English as a second or third language as a weakness, when in fact, being bilingual is a strength. And I see this often with perception of immigrants or perception of people come from different cultures, that what is perceived as a weakness is actually something that opens a lot of doors.
For example,
if
your weakness is not speaking English as your first language, how are you going to make that look like a strength? Well, you can say, I am fluent in so and so languages. I understand, my English, it's something that I'm working on. But in order to improve my English, these are all the things that I am doing to improve my English. So yes, it's not my first language, but I speak all these other languages so I can communicate with other people. But despite English being my second language is being my weakness, I'm working on it. I'm taking English classes. I talk with my friends in English, and every few months, I take the time to see how I'm doing with my English. What are some of the words I need to learn how to pronounce better? And then I practice how to pronounce them in front of the mirror, or I ask my friends to correct me. And so I can learn these are all the things that I'm doing to get it better. So that way I'm like, yeah, it's a weakness, but I'm telling you how it's a strength. And I'm also telling you what I'm doing to get better at it and how to fix it and how I'm self-aware of it. So that's kind of like, oh, when employees hear that, they're like, oh, okay, I can work with this.
I think that's great advice. The other question I had for you is related to having ADHD, a learning difference.
Mm-hmm.
There's a lot of stigma associated with having different ways of learning. What would you tell a student who suspects that he or she might have a learning disability or a learning difference? What would you tell him or her?
Talk to your school, I think it's a school counselor or dean, whoever, and have them connect you to somebody where you can get tested. If you can't get tested through your school, primary care providers, you can talk to your doctor about it and they can connect you to testing. So basically my advice is get tested as fast as possible. Don't wait, just get tested.
And once someone receives a diagnosis, how does that help them in terms, like practically? Were you able to then have access to learning about how to cope with your learning disability, or did that help you in terms of different testing I don't know, extra time on tests or things like that? Were there practical accommodations that were made for you?
That's the reason why I'm saying to get tested
Yeah.
is being the extended time in a private, quiet room does make a huge difference. You wouldn't think of it, and it's mostly so you can get those benefits. Is mostly is a quiet testing room and extended time. But either way, the only reason why you need a testing is for that aspect. I do think that choosing or not choosing to take medications, there's no right answer. Now, as a resident, I don't use medications. And I went through all of undergrad and grad school. I got 2 graduate degrees without medications. So if you do have a learning disability like ADHD, be very well organized, very self-aware, make lists. I used to have a bag with all of my study supplies in it, and I knew which places to go study, that I wouldn't be distracted. I had the earplugs. I studied with friends, but I had cards that would say do not disturb, which means I was not allowed to talk to them when they had that up. I could only talk to them when they had the break sign. And then when we did talk, I would put like a 5 or 10 minute timer so that I wouldn't just get distracted. I read about different study habits, different study techniques, and figured out which worked the best with me. And then the testing is mostly so you can get the extended time, and then see what resource you can get connected in learning specialists. Some of them are good, some of them are not. But a lot of the times, if you can't afford them yourself, having the diagnosis does push your school into, will give you access to those things. So that's the reason why I think testing is good.
That's really practical advice. Thank you. I'm sorry, did you want to add more to that?
Well, basically it.
What was my other question for you? It just went right out of my head. Speaking of focusing. Oh, I wanted to ask you if you have any memories of Montgomery College related to a particular faculty member or a mentor or an advisor or a particular class, something that you found particularly meaningful or helpful to you when you were at Montgomery College?
I mean, I guess I would say my organic chemistry lab professor. I had a different professor for lab and different professor for the course. I didn't like the one for the course. And so my lab one would spend hours and hours and hours explaining everything to me. And he's the main reason why I was able to pass the class. I didn't understand how my other one explained stuff. So yeah.
Do you want to mention the one that helped you by name?
I don't remember. I knew he was Egyptian, but I don't remember his name.
Did you make use of any of the resources at the college, like the writing center or some of the student support services? Of course, you weren't diagnosed with a learning difference yet, but do you remember anything in particular about Montgomery College that was helpful to you?
To be honest, at that time, I was working. And so I mostly went to school for class. I did study at the library a couple times, but for the most part, I went to class and then went home. It wasn't until undergrad that I started spending more time in school. And I didn't really know how to utilize resources until I learned in medical school how to utilize the resources that were available to me. So this is where definitely I think it's really important to know what resources are available in school and make use of them. I could have used them better. I just didn't know how to.
A few years ago, you came and spoke to my class, and it was a very interesting conversation. One of the things you said that I found particularly interesting was about community colleges and about how the affordability of community colleges really enabled you to then continue your education. Do you want to talk a little bit about that? About I think sometimes there may be perceptions about the quality of community colleges, but do you want to talk about your experience with the education and how it enabled you to then go on to a 4-year university?
Yeah, I can do that. I think that there's nothing wrong with going to community college. I was embarrassed about it when I was going through a community at Montgomery College, but for me, it was my only way to go to college. And so I don't think it's important. I think it's important not to focus on where you're going. It's the fact that you are going and you have the opportunity to. I could have gotten loans for undergrad, if I understood, but that would have been a waste of money. I would owe a lot more money had I gone the loan route. For me, community college enabled me to work. It enabled me to pay for my school while I was in school. And it also enabled me to save up for my 4-year school. So, so I graduated from undergrad without any loans. It also, at the time that I went, if you did an associate's degree, you got a guaranteed acceptance at UMBC and I think College Park. So if you don't have good grades coming out of high school, that's a good way to get into our state schools, which are amazing. If you don't have the money to pay for school, Montgomery College, at least when I went, was one of the top community colleges in the country. And so being one of the top community colleges, you get a great education. I don't know, it's an amazing opportunity. So, and I was able to reach my goals regardless of where I started. It doesn't matter that I went to community college. I'm still a doctor. Where you start, it shouldn't matter. And I've met other people who've gone to community colleges here in California. And now they're going to graduate from medical school this year. So don't focus on it's a community college. No, focus on it's an opportunity. And this is my entryway to make my dreams come true.
That's very helpful. And thank you for saying that and sharing that experience. Where do you see yourself in the future? Do you picture yourself staying in California? Do you want to eventually return to Maryland? What are your goals for your career and personally?
I want to work as a family practitioner. My husband and I haven't decided if we're staying here in California or in Maryland. I do see myself working. If I stay in California, I'm planning on working for county in the county clinics, which is where I'll be working with a lot more like the immigrant populations and stuff. If I do go to Maryland, I do see myself practicing in Langley Park, in a community clinic there. So that's where I see myself career-wise is family doctor. Some of my things that I'm really passionate about is within the whole scope of primary care and working with the immigrant community is women's health. A lot of the times women aren't empowered. And so empowering women to dream big, reach their goals, and have power over their reproductive health is some of the things I'm really passionate about. I do want to work with women who've been in very bad situations and kind of be their primary care provider in that sense. And then I love teaching people about diabetes, hypertension, and how to eat healthy. So definitely love my field. So I see myself doing that for the rest of my life.
I love that. Thank you so much for sharing that. How do you feel about sharing your story today? What emotions are you experiencing right now?
It's exciting. I'm really hoping this will encourage people and help them reach, encourage them to dream big and inspire them to dream big. They know that other people have done it, which means they can too.
I think your story is very inspiring. I have another question that I'd like to bring up related to the concept of home. Many students who have lived in different places, and you've certainly lived in different places, have talked about how they're not sure always where home is. When you think about the word home, what do you think of?
I think home is people well, actually, it's really hard to describe. Let me think a minute about it.
Yeah, I think a lot of students have said that home for them is related to family, not so much to a particular place. I've heard some students say that.
You have multiple homes too, because for me,
Right.
home is Guatemala, home is Maryland. But if I'm in Guatemala, but Reggie's not there, it doesn't matter. If I'm in Maryland and Reggie's not there, it doesn't matter. So for me, I guess home is my husband.
Is your husband also from a Latino background?
Yeah, he's Panamanian.
Interesting.
Yeah.
Have you had a chance to go to Panama to meet his extended family, or are they all in the States now?
I was supposed to go in 2 weeks, but I don't have my passport yet. So we're planning that trip.
I hope you'll have the chance to go. When you go back home to Guatemala, is that in Guatemala City?
Actually, no. My family is from Guatemala City, but I spent most of my time in Lake Atitlan. And so that's home for me. When I was in boarding school, they'd be like, "So you're from the capital?" I was like, "Mm-mm, I'm from San Pedro. That's my home." And so, yeah.
That's a beautiful part of the world.
Yeah.
Is there anything else you'd like to share today, or anything you'd like to add to the conversation? Anything we've missed that you feel is important to share?
No, mostly just letting all your students know that, dream big, make your goals, and it might be harder, but I think that what's really important is not to focus on how much harder it is for you. Focus on your journey, focus on reaching your goals, and you'll be surprised how many people you will meet at the end of that journey, realizing that they had also similar stories to you, or even harder struggles than you. So it's more of a anything is possible. Just work hard.
I know how busy you are, so I am so thankful that you took some time today to share your story with us, and I'm truly grateful. Thank you.
Of course. Thank you so much. I really appreciate you thinking about me for this project.
Thank you, Stephanie. Dr. Baker.